What makes certain conjunctivitis infections spread easily? Imagine your eyes as delicate windows that can quickly become gateways for infection if the right conditions are met. Certain types of conjunctivitis, especially viral and bacterial forms, are highly contagious because of how easily they transfer from one person to another. The main reason is how these infections move from person to person through different pathways. The most common way is through hand-to-eye contact. When someone touches contaminated surfaces or objects like towels, tissues, or makeup, and then touches their eyes, the infectious agents can enter and cause infection. This is why touching your eyes without washing your hands is such a big risk. Contaminated objects, called fomites, also play a big role. Sharing personal items like towels, washcloths, or eye makeup can transfer bacteria or viruses directly into the eye. For contact lens wearers, improper cleaning or sharing lenses can make it easier for infections to spread. Respiratory droplets from coughing or sneezing are another route, especially for viral conjunctivitis. These droplets can land on surfaces or directly reach the eyes of others nearby, spreading the infection quickly. Some viruses, like adenoviruses and enteroviruses, are especially contagious. They can survive on surfaces for days and spread easily through minimal contact. Bacterial conjunctivitis, caused by bacteria such as Staphylococcus or Streptococcus, also spreads rapidly, especially when hygiene is poor. Infections caused by herpes simplex virus or varicella zoster virus are also highly contagious and can spread through direct contact or even aerosolized particles. Environmental factors and behaviors significantly influence how fast these infections spread. Poor hand hygiene, frequent touching of the eyes, and crowded places like schools or clinics make transmission more likely. Contact lenses, especially if not cleaned properly or worn for extended periods, increase the risk of spreading or catching conjunctivitis. Young children under 5 are particularly vulnerable because they often have less developed hygiene habits and tend to touch their eyes more often. It's important to note that allergic conjunctivitis, caused by allergens like pollen or dust, does not spread between people because it's not caused by infectious agents. To prevent the spread of contagious conjunctivitis, good hygiene is key. Regular hand washing, avoiding touching or rubbing the eyes, not sharing personal items, and properly cleaning contact lenses can make a big difference. If you or your child develop symptoms, staying home from school or work until the infection clears helps prevent spreading it to others. In newborns, doctors often apply antibiotic ointments right after birth to prevent bacterial infections acquired during delivery. In summary, the contagious nature of certain conjunctivitis infections comes down to how easily viruses and bacteria can transfer through contact with contaminated hands, objects, or respiratory droplets. Behavioral habits like poor hygiene and environmental factors, such as crowded settings, greatly influence how quickly these infections spread. Practicing good hygiene and taking precautions are essential steps to keep yourself and others safe from infection. Always consult a healthcare professional if you suspect conjunctivitis to get proper diagnosis and treatment advice.